It started because I recently moved into semi-retirement, out of semi-retirement into retirement, and I thought, well, now's the time to go through and check up things that I've been postponing for a while. And even although I had been trying to do some improve my fitness, I had noticed that I was getting more breathlessness. So I went to the GP, normal story, no dramas there, but let's send you off to the cardiologist. Cardiologist says, get on the treadmill, do the test. Yeah, that's okay, you did pretty well there, but because you've got a family history of heart disease and you did only just okay, not fantastic, and your breathlessness, let's take it another step.
So over 12 months ago, I fainted at a conference while talking to some colleagues. Went to hospital, no problems, checked it with the GP, did some further tests in Sydney, and angiogram discovered I was 80% blocked left main artery, unbeknownst to me, and no symptoms. Working a few days a week, playing golf regularly, having dinner and social time with friends and family, pretty normal.
The trigger was because I was shortness of breath from walking. I couldn't travel 40 metres in distance. I had to stop. My heart was pounding. My chest was sore. So when I stopped, I had to take a rest break of about 10 minutes or more before I can continue on walking. That was my first sign of it. My cardiologist told me, he said, you're going to have to get an angiogram done. And the doctor said to me, once you get that done, we can make a diagnosis from that, seeing if you need to go and have an operation, or we can put a stent in.
So then the cardiologist sent me off for a CT angiogram, which is in the big machine. And when I went back to see him, the results were that I had a blockage somewhere. The degree is not detailed at that point. So he recommended the next step, which was a angiogram, where they stick the wire either up your groin or up your wrist into your heart, and the likely outcome of that is a stent. One night in hospital, no big deal. My brothers had it. I had 100% blockage in one artery. I had an 80 in another, 70 and 60 and so on. And it turns out I was a walking time bomb. Do not leave hospital. Do not collect $200. Do not pass go.
It was explained to me that the blockage in my left main artery was called the widowmaker, so that if you don't do something about it, the consequences are bad, compared with if you do something about it, you've got a chance. And the chances were, they said, were pretty good, so you go with the flow.
Once they'd done the angiogram and all this, I was put into the recovery room. The recovery room, I waited in there for the whole day till that stopped bleeding. But they told me, said, you're not going home, you are staying. They found 3 main blockages. I was surprised that it was really urgent. That actually got me worried. I said, what's really wrong with me?
You know, I was thinking, oh, this will be over, I'll be home in a few days. And then being told that you're going to have open heart surgery and they're going to cut your chest open is quite a bit of a shock to the system. Your life flashes before your eyes, of course, and you write letters to your loved ones and you do all that. And it is quite, the whole process is quite emotional, and your feelings, you know, go from here to there. So, you know, the fact that you need your visitors, and that's good, both before and after.
Well, the way it was explained to me by the surgeon was that they would do a bypass of one of the left main artery and a secondary artery as well. He just drew the arteries and showed me where the blockages were, showed me where he would bypass. That explained it graphically, which was probably the best, because they use big words and we don't always understand those, being a layperson. But of course with surgery you do have the scar down the middle of your chest and some restrictions for a while after that, but that was all explained. No problems really.
The knowledge of the whole operation and the procedure, including the recovery, to me was important to know, and there's a couple of good booklets from the Heart Foundation that's helpful in that regard. And also the nursing staff. Chat to the right nursing staff and you'll be surprised what you'll find out.
The documents were explained and the situation was explained, risk was explained, so just was a no-brainer for me, because I had confidence in the people that they had the ability to do what they said they would do.
The more I think that you know about these things, the more you feel I do feel comfortable in yourself.
The doctor actually told me the risks that were involved and all this, and I was happy with what he told me. I understood it to the letter and gave me the form to sign.
So in the few days before the surgery, I conducted my activities pretty much as normal, and I just had a restriction on diet the night before the surgery because the surgery was scheduled early morning the following day. So pretty much normal activity, and I didn't have too much time to think about it, so it was really good.